Welcome to our evening broadcast of the biohackerPT. Tonight's live stream will be talking about pain, inflammation, immunity. Now, how is that all related? What is the connection, if there is any connection? We need to know. Specifically, we're going to look tonight at the role of serotonin in the treatment of pain. Now, we're going to look at different research articles and try to see if we can gain an understanding. Now, we need to know why we are headed this direction, kind of the background, and who we are at this channel. This channel is based on biohacking. Now, what is biohacking, you might ask? Is that something that is involved with CRISPR-Cas technology? Is it dealing with transhumanism? No, it's not. It's dealing with how to hack into better health using technology and natural healing methods. Now, since I am a physical therapist, I'm going to talk of how it relates to using it in a physical therapy realm. Now, I deal with people with pain. I deal with people who are trying to recover. We deal with lifestyle issues. So this is where we're going to look tonight in its pursuit and talking about pain. Now let me just check a couple of things on the screen. Make sure that we are on. All right. Now we're going to see if we can get that video capture going here, making sure that we can see what is on the screen, because we've got a lot to cover tonight. There it is. Now, let's go directly to the show, the presentation. Topic: the role of serotonin and the treatment of pain. The pain connection. Now you can join on the chat. We're on multiple streams today. Facebook Live, YouTube, Twitter, Periscope, and JoshWho TV. Now we're going to look specifically on the JoshWho Search Engine. We're not looking at Google. We're not even using DuckDuckGo. We're using a search engine called JoshWho TV. And I find that as a very effective research search engine that you should use. Now, let's look and see the pain connection. Now we're looking at different PT biohacks. We're looking at, sometimes we talked about this in the last live stream. A lot of the times we look at this structural approach when it comes to pain. What is the anatomy? what is the structure that's involved with this pain? Okay. Now, what I like to do is look at some other things that are a little bit more, I would say, out of the box or out of the ordinary. We want to look at myofascia and its biotensegrity. You're wondering what that is. We'll move on that. We'll continue on looking at other things. This is another one on the neurodynamic approach. Okay. Now, there's also what we call the functional approach, and this is where we're going to look at in this broadcast today, specifically the biochemistry and neurophysiology of serotonin. So this is where we're going to begin. Now, this is going to be the launching pad of multiple different broadcasts surrounding this issue. We can speak about the mitochondria. We can speak about neurotransmitters. We can speak about the whole plethora of neurotransmitters and hormones. We can move from serotonin to this being the precursor to melatonin, which has a role in even testosterone, how it can be in involvement with how we get this in our body. And that can be involved with how it relates to circadian rhythms and sleep, and how your sleep is improved by certain things that you can do. We can talk about how light affects the levels of vitamin D. We can talk about how light, or even on the skin surface, how vitamin D can play a vital role in the whole aspect of this biochemistry. We can even talk about the pineal gland, how that's involved with melatonin production. We can talk about how melatonin can be enhanced by calcifying the pineal gland. We can talk about the pituitary and the hypothalamus and the adrenal and the gonadal axis. We can seek greater awareness of this neural matrix and how it can be involved with all of these conditions. We can look at specific supplements that can be enhancing for you. We can also talk about how you need to go to your physical therapist for an exercise program, or how you can speak to someone involved in nutrition, be it a naturopath, or be it a registered dietitian, or to speak to a functional medicine doctor, or to be able to pick up a book and listen to the experts. There's so many ways and avenues that we can go with this. Now, we are just going to scratch the surface with serotonin. We might not even get there because we're so, looking at this overview, this forest, instead of this specific individual tree called the serotonin. Now, wish I can do a sound check, but it looks like there is some freezing going on with at least one of the channels that I'm on. Let's see if it will correctly go forward here. All right, we'll see. We'll see if it comes through or not. All right, so let's move forward and see if we can be enlightened Now, I will try to see if I can put at least somewhere this slideshow, and I guess it's the document that's involving the data here. Now we're going to look specifically at this one here. All right. It looks like we are lagging on one of the channels that I'm on. Hopefully we are okay on other channels, wherever you are. Chime in if you're thinking that we're dropping frames. All right. Now, where were we? Now this is the search engine that we're going to use, called JoshWho Search Engine. And we're going to plug in the words serotonin source. Now this is dated today, October the 12th, 2020. So this is what comes up. Seven foods that could boost your serotonin. 8 foods that boost serotonin naturally. How to increase serotonin in the human brain without drugs. How to increase serotonin, 5 ways to raise serotonin levels. Now, the one that we chose here is this first one, I believe. Microbes help produce serotonin in the gut. Let's see if that's correct. Yes, it is. Now, on this channel, we talk about the gut a lot. Well, maybe not a lot, but I would say enough. There we go. And there is a connection with serotonin. Where is it produced? Is it produced in the brain, where I thought? In my research, I looked and I found out that it is more than that. Okay, in this article called Microbes Help Produce Serotonin in the Gut by someone in Caltech magazine, dated 2015. Although serotonin is well known as a brain neurotransmitter, it is estimated that 90% of the body's serotonin is made in the digestive tract. Wow. That is, I would say, a revelation to some people. Now let's see if we can get this with, let's see, I'll use a little different view, I think. There we go. All kinds of technical stuff for prowess. Now it says here, certain bacteria in the gut are important for the production of peripheral serotonin. Now, what are these bacteria? Well, they're in the gut, the microbiota. Now we know that the microbiome is not only in the gut, but it could be the skin, it could be many different aspects, but we're specifically looking at the microbiota of the gut in this situation. Peripheral serotonin, there are 2 types. There's the neural serotonin and the peripheral serotonin, and we'll talk about that in a minute. Peripheral serotonin is produced in the digestive tract by enterochromatophin, EC cells, and also by a particular types of immune cells and neurons. Serotonin in the gut. Okay, so that would be the next article. So let's see what level that is. It's the second level, maybe. Microbes. Let's see here. What's the article title now? Yes, serotonin in the gut. What does it do? This is in the magazine or the journal Frontiers in Neuroscience, 2012. Most of the body's serotonin is synthesized and stored in the intestines. Both neural and mucosal sources of serotonin, or the peripheral ones, within the gut, and the widespread and overlapping distribution of specific serotonin receptor subtypes. So both neural and mucosal sources of serotonin within the gut and the widespread and overlapping distribution of specific serotonin receptors. Perhaps mucosal serotonin only plays a significant role after some kind of pathological insult like inflammation. On the other hand, neuronal serotonin is clearly required for normal function. So there are two aspects. Now, if we go to the actual article itself, which we should do, at least for the first one, we want to see if there are any specific, let's see here, let's see, let's go back a page, I think. Let's go back to this one here, getting ahead of cells. Are there any pictures involved here? Let's go to the next one. I think the next one will give a little bit more information. All right, let's look and see if there is some figures. All right, so this one doesn't have any figures. There's some coming up. Now let's go back to seeing where we have this one portion here we were talking about. I can't find it. Okay, so let's move on. Clearly, the role of mucosal serotonin remains enigmatic and requires further study, especially as this is the source for all circulating serotonin. Now, another article is found in Medical News Today. Let's see if we see that one. Level 3. Level 4. No, let's see. All right, let's just go directly to the article itself. There it is. What is serotonin and how it's function? So let's look specifically at what it says. It is believed to play a role in the central nervous system and in the general functioning of the body, and especially the gastrointestinal tract. It is mainly found in the brain, bowels, and blood platelets. So would that be in the bloodstream? In the plasma itself. Serotonin is used to transmit messages Let's see here if I can get this here. There we go. Between nerve cells, it is thought to be active in constricting smooth muscles, and it contributes to well-being and happiness, among other things, through constricting smooth muscles. Now, we deal not so much with smooth muscles. We can be actually involving smooth muscles, but skeletal or skeletal muscles is what we usually see in therapy, but we can also talk about the muscle system. It is produced by the intestines and the brain. It is also present in the blood platelets and central nervous system. Now, tryptophan, we think about that as Thanksgiving dinner as we come closer to that. This is a precursor, a main ingredient that the body needs to make serotonin. Eating foods high in this essential chemical doesn't mean that the body will absorb and use it, but making tryptophan available when needed will improve serotonin synthesis. Produced by the intestine, the brain. All right, so let's go to the next article in the journal Innovations of Clinical Neuroscience in 2013, dealing with sunshine. Okay. Serotonin is a neurotransmitter that is primarily located in 3 areas of the body. Number 1, the central nervous system. Number 2, the mucosa of the gastrointestinal tract, the largest producer of serotonin. And 3, the blood platelets. Serotonin is synthesized from the essential amino acid tryptophan, which is orally ingested and found in foods such as banana, pineapple, plum, turkey, and milk. All right, those are some examples of where you can find tryptophan or tryptophan. In addition to other body sites, the brain, gut, and platelets, serotonin is present in human cutaneous tissue. It's also found in the retina. While the photostimulation of serotonin may be mediated in a number of ways, including the retinography tract via the retina, one intriguing possibility is that sunshine may directly stimulate the production of serotonin through the skin. How about the effects of serotonin in immune cells? In the article from the Frontiers in Cardiovascular Medicine, 2017. Now, we want to understand the who aspect. In the first broadcast we had about this subject, at least with inflammation and immunity and pain, we talked about the connection. Now, here we have on the picture is the aspect about tryptophan. Now we have the one that's the peripheral effects from the mucosa, blood plasma, and skin. It's involved with different functions here. Now in the central nervous system, the effects are over here, including depression, which is a common one we think about. All right, let's see if we can find another picture. Now this one here talks about its role in inflammation. So that's why we are key in looking at this. I want to get the whole thing in here if I can. Now there's quite a bit of information here, and you might not even see it on the screen. We might have to blow that up individually in sections. So if we think about serotonin, it affects what we talked about a while ago, dealing with the immune system, from monocytes, macrophages, and dendritic cells. And this is involved in the release of these cytokines we talked about, these biochemical mediators, interleukin-1 beta, interleukin 6, the release of the TNF, the tumor necrosing factor alpha. It's involved with the neutrophils. We talked about this also, the phagocytosis of bacteria, the recruitment of sites of recruitment to sites of inflammation, dealing with the lymphocytes. Let's see if I can see that here. The eosinophils, the endothelial cells, and this is what we talked about a while ago with the vascular smooth muscle cells. And this could come from the neuronal system, or even through platelet activation as it relates to inflammation. Now this is another one that's a little bit overboard. I think the one that we want to talk about is how these selective serotonin reuptake inhibitors affect the serotonin. These are antidepressants. Now at this time they might have not had the information for the serotonin norepinephrine reuptake inhibitors. All right, it was a little bit better with the one that I got this information in front, but those are the figures that are from that article. Let's just review what it says in general. Almost all immune cells express at least one serotonin component. Interesting. Almost all immune cells. In recent years, a number of immunoregulatory functions have been ascribed to serotonin. In monocytes, macrophages, for example, serotonin modulates cytokine secretion. Serotonin can also suppress the release of tumor necrosis factor alpha and interleukin 1 beta by activating serotonin receptors. Furthermore, neutrophil recruitment and T cell activation can both be mediated by serotonin. Another name for serotonin is HT, 5-HT, has 2 lives. As a neurotransmitter, it regulates sleep, appetite, mood, and other important brain functions, and separated by the blood-brain barrier and is synthesized in a different way. It plays a central role in many other organ systems as a peripheral hormone. We looked at those figures. In fact, most of the body's serotonin is circulating in the bloodstream, transmitted by blood platelets. Most of the peripheral serotonin is synthesized by TPH1 in the enterochromatophin cells of the intestines, secreted into the bloodstream and then taken up by the circulatory platelets. Platelets store serotonins at very high concentrations in their dense granules and secrete it upon activation. Resting plasma serotonin concentrations around 10 nm can increase rapidly to 10 micro m or more when platelets become activated at the site of thrombus formation or inflammation. So it's talking about how this resting plasma serotonin concentrations, and they can increase when they become activated at these sites of inflammation. More likely than serotonin derived from non-neuronal sources like the mucosa exerts most of the immunoregulatory effects. Now, that's an important statement, how that affects the regulation of your immune system. The immunomodulatory effects of serotonin are mediated primarily through peripheral mechanisms directed towards circulating immune cells. Possible sources of peripheral serotonin are plasma, monocytes, macrophages, lymphocytes, and vascular smooth muscles, adipocytes, mast cells, and platelets. The neurotransmitter and the peripheral hormone serotonin plays an important role in immunity and in inflammation and immunomodulatory diseases. So that's serotonin. Serotonin dealing with the neural serotonin and the peripheral serotonin, the peripheral hormone serotonin, plays an important role in immunity and in inflammatory and immunomodulatory disease. No matter if the serotonin derives from platelets, mast cells, T cells, or even from neurons. For example, it influences diseases like gut inflammation, allergic asthma, rheumatoid, and neuroinflammatory conditions such as ALS and autism. In recent years, we could observe the anti-inflammatory effects of antidepressant influencing serotonin levels in the bodies in clinical practices that are, for example, mediated via macrophage or phage modulation. Serotonin seems to be a promising new target when it comes to modulating the immune response. So, do we need serotonin? Yes. What are the sources? We talked about that. It could be through the digestive tract. Could be from sunlight. It could be from the skin as it is absorbing the UVB rays. So let's look at this one more article the expanded role or the expanded biology of serotonin by Annual Review of Medicine in 2009. Now let's see if we can quickly go to the figures. Here's one. So serotonin has behavioral effects. Now we've not really talked about that, but in the neuromatrix, we know that this can affect pain. And you can see why here. Other central nervous system effects. Sleep and circadian rhythms. Motor control. Respiratory drive. Body temperature. Here are some central serotonergic drugs. We talked about those. The selective serotonin reuptake inhibitors, the tricyclic antidepressants, that's things like we have Cymbalta, Elavil, nortriptyline. Now here we have how it's involved specifically in here. It's involved with pain and nociception. Now this one is not specifically to any body part, but in general, how it is infecting the hypothalamus, pituitary, adrenal axis in the stress response. Alright, so in summary, let's talk about this here. Serotonin regulates numerous biological processes, including cardiovascular function, bowel motility, ejaculatory latency, and bladder control. Additionally, new work suggests that serotonin may regulate some processes, including platelet aggregation. Serotonin typically regulates a given physiological process such as digestion, pain perception, or energy balance. At multiple steps through different and frequently opposing mechanisms. For example, serotonin is not simply pro or anti-analgesic. Instead, it both potentiates and inhibits nociceptive processing at various levels of the nervous system. So there's, in inflammation, or actually immunity, there is this modulation. Now really it should be the same with inflammation, because inflammation at certain times is healing and beneficial, but when chronic inflammation happens, you can have the effect on the system, specifically nerve or neuropathic pain. Serotonin modulates pain perception and nociceptive processing at multiple levels within the central and peripheral nervous system. Within locally inflamed tissue, serotonin releases sensitized peripheral nerve fibers that carry nociceptive information to the central nervous system. So this release of serotonin sensitizes the peripheral nerve fibers. The brainstem serotonin neurons send descending projections into the spinal cord that modulate incoming nociceptive information. Finally, brainstem raphe serotonin neurons send ascending projections to cortical and limbic regions that may modulate the psychological perceptions of pain. Now, those sentences were brainfuls. I think I'm just like, wow. Serotonergic abnormalities have been reported in patients with mood disorders, and altered serotonergic modulation of pain processing at these multiple levels may explain increased pain perception in these patients. The multiple levels at which serotonin modulates nociceptive processing and pain perception may also explain the efficacy of serotonergic drugs in treating pain disorders. So these medications aren't just what we call in certain environments a nerve, well, it's called what's the word? Psych meds. I don't want to take psych meds because it's just for, if I'm crazy. No. It's dealing specifically with what I've read here, the serotonergic abnormalities, and how these alter the pain processing at certain levels. Now, this is directly at the nerve endings, dealing with how serotonin needs to be reuptaked slowly or inhibited. Now, in therapy, as we turn toward this, is that I have to think, well, how is this involved in the clinic? How do I focus on trying to not only create an environment where serotonin is enhanced? Now, we talked about how that can be done through diet, through exercise, through happy thoughts, to watch Seinfeld or The Family Guy, have a little bit of laughter, to have sunshine, not only through your eyes without sunglasses on at times, but on the skin when you don't have sunscreen on at times, at the solar pinnacle of the day. So these are important in the regulation. And not only that, it helps in the precursor, which is serotonin, to make melatonin, which helps you in your circadian rhythms. It's all tying in, and we will continue this process of looking at this. Now, the two last articles, let's just do in a quick succession. Serotonergic mechanisms regulating the GI tract, experimental evidence and therapeutic relevance in the Handbook of Experimental Pharmacology, 2017. Now here, there might be some good pictures as well. And let's see, I'm looking to see if there's an easy way to get to the tables. All right. Now some of these are a little bit heady, I'll call it. All right. So hopefully I will find an easier way to get to these figures. It works so well on the other computer that I use, but let's just go with the summary here. Serotonin, or 5-hydroxytryptamine, 5-HT, is best known as a neurotransmitter critical for the central nervous system development and function. 95% of the body's serotonin, however, is produced in the intestine, where it has been increasingly recognized for its hormonal, autocrine, paracrine, and endocrine actions. In the next article, which I don't have that specifically tagged, I need to go back to do that, but serotonin is one of the neurotransmitters used by a descending system controlling pain transmission. Plain as day right there. This was back in 2006. In spinal dorsal horn, besides modulating glutamate and GABA-mediated effects, serotonin exerts a very complex control, also involving interactions with large number of neurotransmitters and peptides. The final effect of serotonin can be either pro or anti-nociceptive, depending on the receptor type activated. So it could also be pro-nociceptive. So serotonin is going to be dealing with the regulatory aspect of the immune system, and also how it affects the nociceptive proprioceptive system, or the somatic pain levels. Interesting, to say the least. Now, if we went and tried to summarize all this, we can see that in a general sense, serotonin is important to increase in the most sense. And we can do this. It is produced in those areas we talked about: the brain, the gut, the retina, the skin. So we will continue on in further discussions in how to enhance that. Now, tonight's broadcast is a little long. There's a lot of information, and hopefully you can look at some of that information before coming back. I will be leaving some of that information in the sections in whatever platform you're going to be watching this, possibly even YouTube. I think I will put it there. So thanks again for coming in to the broadcast. Now, we looked at the role of a neurotransmitter, a hormone called serotonin. Now, are you willing to move forward to try to enhance serotonin? If you do that, you might find better health, Now, we talk about how serotonin can affect melatonin, and melatonin's production is in the pineal gland. In the pineal gland, that can also be involved with other elements, including spirituality. Are you in tune with the spiritual side? This can help. It can help as a support system with those who surround you. So, step back from the hustle and the bustle, the noise, the continual drone of the news, the pursuit of the latest movie or sports score, and see if you can take that time to take care of your health, your mental health, your social health, and your physical self. And you can always improve that by improving your spiritual health as well. Thanks again for tuning into our broadcast. We wish you the best and the safest October that you can have. We'll meet up with you next time. And good night.